I want to use myself as an example just so that people have a sense of the science here. I shook hands with, hugged, and kissed, not the doctors, but a couple of the nurses at Emory because of the valiant work that they did in treating one of the patients. They followed the protocols, they knew what they were doing, and I felt perfectly safe doing so.
Mr. Secretary General, thank you for bringing us together today to address an urgent threat to the people of West Africa, but also a potential threat to the world. The people of Liberia and Sierra Leone and Guinea are in crisis. As Secretary General Ban and Dr. Chan have already indicated, the Ebola virus is spreading at alarming speed. Thousands of men, women, and children have died. Thousands more are infected. If unchecked, this epidemic could kill hundreds of thousands of people in the coming months. Hundreds of thousands.
Outside the John F. Kennedy Hospital in Monrovia, Liberia, 20-year-old Ibagasti Wo is sick. His parents wait beside him. All signs point to the late stages of Ebola, the deadly virus that's killed more than 2,300 across West Africa.
He just vomiting, he toiling, vomiting, toiling, he eat, he vomit. Don't let him get a paper back.
As sick as he is, he won't be allowed inside. The largest hospital in the nation, and many others just like it, are completely full.
But I want to tell you, any hospital now will go to the same month. They say we should wait, the doctor should come.
This is Ben C. Solomon in Monrovia, Liberia. This city of 1.5 million is the first major metropolitan area to face an Ebola outbreak since the virus was discovered in 1976. Hundreds have died here since the outbreak began in May. And the World Health Organization expects thousands of new cases in the coming weeks.
Again, here are the headlines. It's the top headline up on drudgereport.com. CDC refuses to identify where previous Ebola test originated. They're hiding the Ebola test location. CDC refuses to identify where previous Ebola test originated. Tuesday evening, the CDC confirmed what we reported on in the morning to Breitbart News that individuals in the United States had been tested for Ebola. Those tests came back negative. You can't believe any of that. But the CDC would not identify the states where they originated.
It's impossible to look in a glass ball and say we're going to have this many or that many. But we anticipate the number of cases occurring per week by that time is going to be somewhere between 5,000 and 10,000 a week. It could be higher, could be lower, but it's going to be somewhere in that ballpark. And the goal now is taking all the different pieces of the response that are planned, everything from the Ebola treatment centers to the people deployments to the community engagements, and trying to make sure we've got that capacity in place by that time so that we can ensure 70% of cases can be properly managed or isolated.
I think we've got to let the science guide us. I don't think all the information's in on whether this drug is helpful. What we do know is that the Ebola virus, both currently and in the past, is controllable if you have a strong public health infrastructure in place. And the countries that have been affected are the first to admit that what's happened here is that their public health systems have been overwhelmed. They weren't able to identify and then isolate cases quickly enough. You did not have a strong trust relationship between some of the communities that were affected and public health workers. As a consequence, it spread more rapidly than has been typical with the periodic Ebola outbreaks that have occurred previously.
The science here. I shook hands with, hugged, and kissed, not the doctors, but a couple of the nurses at Emory because of the valiant work that they did in treating one of the patients.
We found a lot about the virus. The discovery was made way back in 1976 from Sudan and the present-day Democratic Republic of Congo. Since then, we've been having outbreaks of Ebola viral hemorrhagic fever, as it used to be called. So far, we found over 30 outbreaks of Ebola hemorrhagic fevers prior to the one that we started having in the West African sub-region. Prior to that time, the virus has never crossed the borders to the West African sub-region. Albeit the one we had in Côte d'Ivoire, and that was the only one then. So since then, we've been having the transmission between Guinea, Liberia, and Sierra Leone. And we know once it's in West African sub-region, it could be in any of those other countries in the sub-region, because of the closeness and then the spirit of ECOWAS that permits citizens to move within these countries. So that we had it in Nigeria is not a surprise. We've all been waiting for it because the Minister of Health has been sending alerts to the states that with the upsurge in the Ebola viral disease in those neighboring countries being reported. So Nigeria as a country, we should prepare ahead of time. And it's part of this that we are able to detect the virus when a passenger showed up in one of the health facilities in Lagos. It's not airborne, so to speak. It is transmitted through the vector, fruit bats. The fruit bats contaminate fruits and vegetables through their saliva, through their feces. So if they eat any of the fruits, they get the fruits contaminated. And whoever comes across this contaminated food will definitely come down with the disease after eating such contaminated fruit and vegetable. So we know that. And the reports of Ebola viral disease in non-human primates mentioned is as a result of that. I haven't had contacts with infected fruits. These non-human primates depend solely on the fruits. So once they eat and they come down, they will have the disease. And anybody coming into contact with these infected non-primate animals too will definitely come down. So we know the route of transmission. But we may have that where we have people circulating the virus, and the virus is in large quantities, say a million particles, possibility of generating aerosols cannot be ruled out. So when, for instance, in the hospital setting where they are being taken care of, and when the viremia level is on the high side, so any of the spillage could be dried up and be blown by air. So it's not impossible that we have aerosolized virus particles.
Sense of the science here. I shook hands with, hugged, and kissed, not the doctors, but a couple of the nurses at Emory because of the valiant work that they did in treating one of the patients. The science here. I shook hands with, hugged, and kissed nurses at Emory because of the valiant work that they did in treating one of the patients.
The Ebola virus infection is systemic, meaning that it attacks every organ and tissue of the human body except the bones and skeletal muscles. Ebola HF is marked by blood clotting and hemorrhaging. Although it is not known exactly how the virus particles attack cells, it is postulated that one factor that allows them to do so is that they release proteins that dampen down the immune system response. The Ebola virus attacks connective tissue, multiplying rapidly in collagen. Collagen is the tissue that helps to keep the organs in place. The tissue is basically digested by this virus. The Ebola virus causes small blood clots to form in the bloodstream of the patient. The blood thickens and the blood flow slows down. Blood clots get stuck into blood vessels, forming red spots on the patient's skin. These grow in size as the disease progresses. Also, blood clots does not allow a proper blood supply to many organs such as the liver, brain, lungs, kidneys, intestines, breast tissue, testicles, etc. Spontaneous bleeding then occurs from body orifices and gaps in the skin, such as needle puncture marks and rips that can suddenly appear. Death is caused by huge loss of blood, renal failure, or shock.